Hi, I'm John Sievert, physical therapist and owner of Body Logic Physical Therapy. Today what I want to talk to you about is what's a PT? What I mean by that is what's a physical therapist and how do we function in the healthcare environment? A PT, as I say to a lot of my patients, is an expert in musculoskeletal medicine. We're the ones that you want to come to with any kind of ache or pain or numbness or tingling or any weird functional difficulties in your body. Many questions that come to me are, what's the difference between you and a chiropractor? Or shouldn't I see a massage therapist if my muscles are sore? Or maybe I just need to see a personal trainer to get things going and get stronger, to get rid of my back pain. These are some of the questions I want to answer for you. So let's have a look. So let's talk a little bit about what's in a name. So PT, this is what typically everybody has in their education through the American Physical Therapy Association, our national chapter. We get a designation now of a doctorate in physical therapy. What that means is a doctorate is we have a doctorate degree, an entry-level doctorate degree. These are 3-year programs that after your 4-year science degree of some sort, going to physical therapy programs are anywhere from 2 to 3 years. And you graduate with this doctorate degree in physical therapy. This is now, every new graduate has a DPT. Other designations that happen as a physical therapist, working in an outpatient clinical setting, let's say at a hospital or in a private practice, is going to be OCS. That stands for an orthopedic clinical specialist, a specific certification and specialty within the American Physical Therapy Association. So just to specifically talk about outpatient orthopedics and musculoskeletal pain, I'm going to elaborate a little bit more on the OCS. So you have a musculoskeletal problem, so some sort of an ache or a pain in your body. My advice is always to find the most highly skilled physical therapist in your community. And that's typically going to be somebody that has an OCS, an orthopedic clinical specialty. And they're probably already a DPT because that's their professional educational designation. Another thing that you may find is somebody might have the letters after their name of an O.M.P.T. This very long acronym stands for the American Academy of Orthopedic Manual Physical Therapists. This is a specialty organization that brings physical therapy, the art of spinal manipulation and hands-on treatment, the most highly skilled physical therapist in manual therapy or trying to do differential diagnosis with all kinds of musculoskeletal problems. This is the designation you're going to want. If they become a fellow, that means they've gone through a specific designation of hundreds of hours of clinical residency and fellowship training, and they pass their exam. They are now a fellow within the American Academy. And that's somebody that's going to have the highest level of skill and training that can help you with your differential diagnosis of musculoskeletal pain. Many patients ask me the question, hey John, what's the difference between seeing you, a physical therapist, and a chiropractor? Who should I see about my back pain? Well, here's the issue. You have a doctor of physical therapy and a doctor of chiropractic. Both of us are vying for the patient in the musculoskeletal problem arena. So we both treat that and we both do a very good job. What you're seeing now as the DPT designation is the extra level of training in differential diagnosis and ruling out the red flags, the real big problem areas, and getting the patient to the physician for, let's say, imaging if they need to. We are now becoming the musculoskeletal experts in most communities. We have the skill and training to do musculoskeletal assessments, which is similar to a diagnosis in the medical world. But in the musculoskeletal world, we can help you with the problems you're having with any kind of musculoskeletal problem. Another thing that we do as physical therapists is we do spinal manipulative therapy. And this is done in an end-range treatment technique to move joints that possibly may have some stiffness that can improve function. And the way we do it as physical therapists is very different than the way chiropractors move joints, and the philosophy behind moving joints is also quite different. I will just speak on what we do as physical therapists, as we do joint mobilizations in a very subtle and gentle way, all the way up to maybe a quick manipulative thrust in a very small amplitude, which is training within our scope of practice. A physical therapist or a doctorate in physical therapy, we treat all kinds of dysfunctions. And a physical therapy truly is your musculoskeletal expert. And I say that because we're the person you want to come to manage any of your musculoskeletal problems. And I'm now going to show you a few simple ways in which we do that as skilled orthopedic manual physical therapists. One of the greatest things that a skilled orthopedic manual physical therapist can do is help you out, the patient, with your differential diagnosis. What I mean by that is you come in to see a physical therapist, you've got your referral from your physician, and it says neck pain or it says shoulder pain. We're going to be able to help you. Is it a neck problem versus shoulder problem? Or is it a low back problem versus your hip problem? And what is OA? Is it OA, osteoarthritis? And what can you do about it? You may have these diagnostic labels given to you, but we're going to help you work within that diagnostic label and get out of pain.